Hello and a very warm welcome to our channel. Let's talk about something that media, and sometimes even doctors, tend to ignore: intimacy, sexuality, and safe sex after the age of 60. It's a topic that's often met with silence, but the truth is, a healthy and fulfilling intimate life is a vital part of our total well-being, no matter our age. But the rules of the game do change. Our bodies change, our health changes, and the risks we face change too. In today's guide, we are pushing past the stigma to have an honest, practical, and credible conversation based on medical research. We're going to cover it all. Before we dive in, I'd love to know where you're watching from today. Please comment below with your city or country. It's amazing to see our global community. And if you believe these open conversations are important, please take a second to like this video and subscribe to the channel. It truly helps us create more content just like this. Are you ready? Let's begin. For decades, popular culture has sent a clear and frankly damaging message: sex and intimacy are only for the young. As people age, this entire facet of life is supposed to just disappear. This myth is not only untrue, it's harmful. The belief that seniors are, or should be, asexual is one of the most pervasive stigmas we face, and it's time to dismantle it with facts. So let's establish the new normal, which is, in fact, the real normal. Sexuality is a lifelong component of being human. Interest in intimacy, in touch, in connection, and yes, in sex, does not vanish when you receive your first pension check. Let's look at the research. Credible studies consistently shatter this myth. For example, the National Poll on Healthy Aging, a significant study in the United States, found that 40% of individuals between the ages of 65 and 80 reported being sexually active. And among those who had a romantic partner, that number jumped to 54%. Furthermore, a large AARP survey confirmed that a majority of older adults, more than half, believe sex is important for their overall quality of life. The desire for intimacy is clearly present. What often changes isn't the desire, but the circumstances: physical health, the availability of a partner, and the very stigma we are discussing today. This brings us to the why. Why is it so critical to push back against this myth? Because intimacy is not just trivial fun, it is a core component of our health. Medically, a healthy intimate life is linked to significant benefits. Research has shown that physical intimacy, including non-intercourse touch, can trigger the release of oxytocin, often called the love hormone. This can help lower blood pressure, reduce stress, and improve sleep. Studies have also linked ongoing sexual activity with better cognitive function and a stronger immune system. Emotionally, intimacy is the glue that maintains strong bonds. It fosters a sense of being wanted, valued, and connected, which is a powerful antidote to the loneliness and isolation that can sometimes accompany aging. And this leads us to our warning. When we, as a society, pretend that older adults are not sexual beings, we create dangerous blind spots. Ignoring this aspect of life doesn't make it go away, it just makes it unsafe. It leads to a profound lack of education, where seniors are not informed about risks. It creates a wall of embarrassment that stops people from talking to their doctors about legitimate sexual health problems that are often treatable. This silence can lead to feelings of depression, confusion, and deep misunderstandings between partners. The truth is, you have a right to a fulfilling and safe intimate life at every age. The first step is to accept that right for ourselves and to reject the myth that it has an expiration date. Now, let's talk about the biological realities. One of the biggest hurdles isn't a lack of desire, but a lack of information about what's happening to our bodies. These physical changes are normal, expected, and in most cases, manageable. Understanding them removes the fear and allows you to adapt. Let's start with the changes that are common for women, primarily driven by menopause and the resulting drop in estrogen. The most frequently reported issue is vaginal dryness and atrophy. This means the vaginal walls can become thinner, less elastic, and produce less natural lubrication. This combination can turn intercourse from something pleasurable into something painful, which is a condition called dyspareunia. Alongside this, many women report a change in libido or a shift in how they experience arousal, finding that it may take more time or different types of stimulation to feel fully aroused. For men, the changes are often more gradual but just as significant. The primary shift is related to testosterone, which naturally declines with age. This affects erections. It doesn't necessarily mean the end of them, but it means they often change. It may take longer to achieve a full erection, it may require more direct physical stimulation rather than just mental arousal, and the erection itself might not be as firm as it once was. Furthermore, the refractory period, the time needed between ejaculations, understandably gets longer. It's crucial to see these changes not as a stop sign, but as a signal to adapt. And the tips for doing so are highly practical. First and foremost, for dryness and discomfort, lubricants are essential. We will discuss this more later, but a high-quality, water-based or silicone-based lubricant is a non-negotiable tool for comfort. Secondly, foreplay is no longer optional. The days of rushing may be over. Longer, more focused foreplay helps increase natural lubrication for women and ensures men are fully aroused, making the entire experience better for both partners. And this brings us to a critical warning: pain is not normal. Many women, in particular, suffer through painful sex, believing it's just a part of getting older. It is not. If you experience pain, you must speak to a doctor. This is not a sign of failure, it's a medical symptom that often has a straightforward solution, ranging from lubricants to localized estrogen therapy. Ignoring pain only creates a cycle of anxiety and avoidance, when the problem itself is often solvable. There is a dangerous assumption that many people make, and it's one that doctors have even been guilty of. The assumption is that sexually transmitted infections, or STIs, are a young person's problem. This is dangerously false. The data paints a very different and alarming picture. Let's be clear, STIs do not check your age at the door. According to research from major health organizations like the Centers for Disease Control, CDC, and the World Health Organization, STI rates among adults over 50 are not just present, they are rising dramatically. In the last decade, we have seen significant increases in reported cases of chlamydia, syphilis, and even HIV in the 50+, 60+, and 70+ demographics. So, why is this happening? There are several critical factors. First, this is a generation that re-entered the dating world after divorce or the loss of a partner. In their previous long-term, monogamous relationships, pregnancy was the primary concern. Now, with pregnancy no longer a factor, the main incentive for using condoms has disappeared. The focus on safe sex education has always been targeted at teens, completely bypassing an entire generation of older single adults. Second, a new generation of erectile dysfunction medications has enabled more men to be sexually active for longer, and often with more partners. When this is combined with the low rate of condom use, the risk multiplies. Third, both patients and doctors share a blind spot. Older adults are often embarrassed to discuss their sexual lives, and doctors are less likely to ask older patients about their sexual activity or suggest routine STI screening. This means infections go undiagnosed and untreated for longer. This leads us to the practical tips, and these are not negotiable. The single most important tip is this: you must use a condom with any new partner. It does not matter if they are your age. It does not matter if they look clean or seem respectable. You cannot tell if someone has an STI just by looking at them, and many infections, like HIV or HPV, can be asymptomatic for years. The second tip is to get tested. Before beginning a new sexual relationship, you and your partner should both be tested for a full panel of STIs. This isn't an accusation, it's an act of mutual respect and a smart, modern health practice. And finally, our warning. Your immune system is not the same as it was at 25. As we age, our bodies may have a harder time fighting off infections, meaning an STI can have more severe consequences or complications. Furthermore, the symptoms of an STI, like fatigue, aches or rashes, can be easily mistaken for signs of arthritis or just getting older. This is a deadly assumption. This topic isn't meant to scare you, it's meant to prepare you. You are in a new era of dating and intimacy, and it requires a new set of rules. Safety must be your first priority. We cannot have an honest conversation about sex after 60 without addressing the realities of health. For many of us, this age brings chronic conditions like heart disease, diabetes, arthritis, or high blood pressure. These conditions themselves can impact intimacy, but just as often, the medications we take to manage them are the real culprits. This is the critical intersection, the balance between managing your health and maintaining your quality of life, including intimacy. Let's start with heart health. A common and completely understandable fear after a heart attack or a cardiac procedure is whether sex is safe. Many people worry that the exertion will trigger another event. The good news is, research from the American Heart Association suggests that for most people with stable heart conditions, sex is safe. The exertion is often compared to climbing 2 flights of stairs. However, this is only true if your doctor has specifically cleared you for this level of activity. Diabetes presents a different challenge. High blood sugar over time can damage both nerves and blood vessels. These are the 2 systems that are essential for sexual arousal and function. For men, this is a leading cause of erectile dysfunction. For women, it can mean reduced sensation, difficulty with natural lubrication, and a higher risk of yeast infections. And then there is arthritis. When your joints are in pain, the physical mechanics of sex can seem impossible. Pain and stiffness can limit movement, and the fear of more pain can shut down desire completely. But the most overlooked factor is medication. Many of the most common prescriptions for adults over 60 have known sexual side effects. Let's be specific: beta blockers and diuretics, often used for high blood pressure, are well known for causing erectile dysfunction in men and reduced libido in both sexes. Certain antidepressants, particularly SSRIs, can delay or even block the ability to orgasm. Even some over-the-counter antihistamines or pain medications can have drying effects or reduce desire. So, what are the practical tips here? First, timing matters. If you have arthritis, try to take your pain medication about an hour before you plan to be intimate. Or, plan intimacy for the time of day when your joints generally feel best. Second, be adaptable. This might mean exploring different, less physically demanding positions that don't put stress on painful joints. And this leads to the most important warning of all: you must never, ever stop taking a prescribed medication on your own just because you suspect it's causing sexual side effects. Abruptly stopping a blood pressure medication, for example, can be life-threatening. The correct action is to discuss the side effect with your doctor. In many cases, they can switch you to a different class of drug or adjust your dosage, solving the side effect while still protecting your health. The problem is almost always solvable, but only if you communicate. We have now covered physical changes, STI risks, and the impact of medication. All of these topics point to one central, unavoidable solution: you must be able to talk to your doctor. And for so many people, this is the most difficult step of all. Let's be honest about why. It can be deeply embarrassing. You might feel that your doctor, who may be younger than you, will be dismissive or uncomfortable. You might feel that sexual health is a frivolous concern compared to your heart disease or diabetes. Or, you may simply not know how to start the conversation. This silence is a major barrier to your health. It's important to understand this. Your doctor needs to know. A change in your sexual function is not just a personal problem, it is a clinical symptom. It is a piece of data about your total body health. This is our most important research point in this section. One of the most well-known examples is the link between erectile dysfunction and heart disease. For many men, the inability to achieve or maintain an erection is the very first observable symptom of blocked arteries and underlying cardiovascular disease. The problem isn't just the penis, it's the plumbing. By being too embarrassed to mention your ED, you could be missing a critical early warning sign of a life-threatening heart condition. The same is true for women. Pain, dryness, or a sudden loss of libido can be signs of hormonal imbalances, infections, or other underlying medical issues. So, how do you actually do it? Here are practical step-by-step tips. First, write it down. Before your appointment, write your question down on a piece of paper or in your phone. It is much harder to ignore it or back out if it's a physical item on your checklist. Second, use a door opener script. You don't have to blurt it out. Use a phrase to ease into it. Say, "There's a personal topic I'd like to discuss before we finish," or, "I've been experiencing a side effect I think is related to my blood pressure medication." This gives the doctor a clear signal to shift their focus and listen. Third, be specific. "I'm having problems in the bedroom" is vague. Your doctor can't work with that. Be as clinical as you can. "I am experiencing pain during intercourse." "I am unable to maintain an erection." "I have lost all interest in sex since starting this new drug." These are medical facts, and they lead to solutions. And here is our warning: the danger of online miracle cures is very real. If you are too embarrassed to talk to your doctor, you become a prime target for companies selling untested, unregulated, and often dangerous pills or supplements online. These products can have devastating interactions with your existing prescription medications. Please, do not risk your life on a cheap pill from the internet. Your sexual health is a valid and important part of your overall health. It deserves professional, medical attention. Find the courage to write down that one question. It could quite literally save your life. For many people, finding themselves single in their 60s or 70s, whether through divorce or the loss of a spouse, is a disorienting experience. The world of dating and forming new relationships is profoundly different than it was decades ago. This new landscape brings new joys, but it also demands a new level of emotional and ethical clarity. Two words are paramount: consent and communication. Let's begin with consent. There is a dangerous misconception that conversations about consent are only for college campuses. This is completely wrong. Consent is a mandatory, enthusiastic, and ongoing yes to any sexual activity, at every age, in every situation. It is not implied. A yes to dinner is not a yes to sex. A yes to kissing is not a yes to anything more. And a yes last Tuesday is not a yes for this Friday. Consent can be given, and it can be withdrawn, at any time. This is especially critical in new relationships where boundaries are still being established. Here is a clear warning: pay close attention to how a potential partner respects your boundaries. Any pressure, any guilt-tripping, or any attempt to make you feel obligated is not just a red flag, it is a form of coercion, and it is the opposite of consent. A respectful partner will understand and want your enthusiastic agreement. This leads directly to communication, specifically, the talk. This is the conversation you must have with a new partner before you become sexually intimate. We are, of course, talking about your sexual histories and STI status. Yes, it is awkward. It can feel clinical and kill the romance. But let's reframe that. As we discussed in the STI section, the risks are far too high to rely on assumptions. This conversation is not an accusation, it is the ultimate act of mutual respect. It is the first step in building real trust. So, how do you do it? The simplest tip is to have this conversation in a neutral setting, not in the heat of the moment. You can use a simple script. For example, I am really enjoying getting to know you. Before we take our relationship to the next level, it's really important to me that we talk about our sexual health and safety. It's a conversation I have with anyone I plan to be intimate with. Then, ask the direct questions: when was the last time you were tested? And state your boundaries: for my own safety and yours, I will only have sex if we use a condom. Here is the warning: if a partner dismisses your concerns, that is your answer. If they say, "We're too old for that," or "Don't you trust me?" or if they become angry and defensive, they are showing you that your safety is not their priority. A person who truly cares about you will be relieved to have an honest partner who values their own health and the health of others. Understanding the changes and the risks is the first half of the equation. The second half is knowing what practical tools are available to you. These are not crutches, they are smart, medically sound adaptations that make intimacy safer, more comfortable, and more pleasurable. Let's start with the most common and effective tools. We must discuss lubricants and vaginal moisturizers. These two things are different, but both are essential. A vaginal moisturizer is used regularly, perhaps a few times a week, to help restore moisture to the tissue, improving elasticity and overall comfort. Think of it like a daily lotion for that specific area. A lubricant, on the other hand, is used during sexual activity to reduce friction and prevent pain. This is non-negotiable if dryness is a factor. Here is the practical tip: look for high-quality, water-based or silicone-based lubricants. And here is the warning: avoid anything with glycerin, as it can contribute to yeast infections. And never use petroleum jelly or oil-based products, especially with condoms, as they can cause the latex to break. Now, let's address erectile aids. This is a topic surrounded by marketing, but we need to look at it from a medical perspective. The most common tools are oral medications, which you know by brand names like Viagra or Cialis. The research here is clear: these drugs, known as PDE5 inhibitors, work by increasing blood flow to the penis. They are highly effective for many men. But other options also exist, such as vacuum erection devices, or pumps, and in more advanced cases, surgical implants. All of these are valid medical solutions. The warning here is absolute: you must only get these medications via prescription from your doctor. Your doctor needs to review your full health history, specifically your heart health. Why? Because these pills can have a fatal interaction with nitrates, a common medication prescribed for chest pain. Buying herbal or generic versions online is a dangerous gamble with your life. Finally, the most practical tool is adaptation. If you or your partner lives with chronic pain, arthritis, or back problems, the old ways may no longer work. This is where you get creative. The tip is simple: use pillows. Use them for support. Place a pillow under the hips or knees to change angles and reduce strain on joints. Explore different positions. For example, spooning or side-lying positions often put less stress on the back and hips than traditional missionary positions. Don't be afraid to communicate in the moment. A simple "that spot hurts, can we try this?" is essential. The goal is connection, not an athletic performance. These tools, lubricants, medical aids, and simple pillows, are not signs of failure. They are signs of intelligence. They are how you adapt and continue to have a fulfilling, safe, and comfortable intimate life. For a variety of perfectly valid reasons, penetrative intercourse may not always be possible or desired. It could be due to pain from arthritis, recovery from surgery, a partner's health condition, or simply a shift in libido. For decades, this has been viewed as an end. But this is a fundamental misunderstanding of what intimacy is. We must move beyond that narrow definition. Intimacy is not one single act, it is a vast spectrum. The true goal, for most of us, is not an athletic performance. It is connection. It's the feeling of being close, desired, and emotionally bonded to another person. And intercourse is only one small part of that. Let's look at the research. The skin is our largest organ. Simple, non-sexual touch is a primal human need. Studies on human connection have shown that acts like holding hands, giving a long hug, or a simple back rub can trigger a powerful physiological response, the release of oxytocin. This is often called the bonding hormone, or cuddle hormone. When oxytocin levels rise, our stress hormone, cortisol, goes down. Our blood pressure can lower. We feel calmer, safer, and more deeply connected to our partner. This is not a lesser form of intimacy, it is a foundational biological part of it. So the most important tip is to broaden your repertoire. Make a conscious effort to build these moments of connection into your day. This includes holding hands while watching television. It means giving a real hug, not a quick pat, when you say goodbye or hello. It can mean exploring sensual massage, where the goal isn't sex, but simply the pleasure of touch. A useful technique therapists often recommend is called sensate focus. This is a practice where you and your partner set aside time to simply touch each other, exploring with your hands, with no goal of arousal or intercourse. The only goal is to feel the sensation. This removes all pressure and can be a powerful way to rediscover physical connection. And never underestimate verbal intimacy. Telling your partner they look beautiful, or that you appreciate them, is just as vital. Now, we must include a warning. There is a very big difference between evolving intimacy and avoiding it completely. It is one thing to shift your focus from intercourse to other forms of touch. It is another thing entirely if you or your partner has lost interest in all forms of physical affection. No more hand-holding, no more hugs, no more casual touch at all. A complete and sudden withdrawal from all physical connection is not a normal part of aging. It is a major red flag. It can be a sign of a serious medication side effect, an undiagnosed illness, or very commonly, clinical depression. If this is happening, it is not something to be ignored. It warrants a gentle, concerned conversation and a follow-up with a healthcare provider. As we close our guide today, the most important takeaway is this: intimacy does not have an expiration date. It simply evolves. A safe, fulfilling, and connected intimate life is absolutely possible, and essential, in your 50s, 60s, 70s, and far beyond. We've covered the physical realities, the serious safety warnings like STIs, and the vital role of medical advice. But most of all, I hope this conversation has empowered you. Empowered you to ask questions, to seek help, to communicate openly with your partner, and to shed any stigma that society has placed on this beautiful part of life. You have the right to pleasure, the right to safety, and the right to information. What was the most helpful or surprising part of today's discussion for you? Or perhaps, what topic related to healthy aging should we cover next? Please let me know in the comments below. Thank you so much for watching, for being part of this mature conversation. Share this video if you found it valuable. Until next time, stay safe, stay informed, and stay connected.